the station that's on your side. This is Channel 7 News Daybreak.
Well, sometimes we hear it's okay to eat eggs. Other times we say egg whites. There's been a lot of research done over the years, but now we have some new research and glad to have an update on it. The University of Sydney says that put that carton of eggs in your grocery cart. If you're eating it right now for breakfast, have another one. Fry it up. Here to explain why is Baptist Health cardiologist Dr. Scott Davis. Dr. Davis, thanks for coming in this morning. I'm very excited about this research. Yeah, and you brought one.
Show and tell.
Look at you. Yes, thank you.
Bring a prop.
Please don't drop it. Yes, I mean,
come prepared.
Yes, exactly.
Interesting research has come out of the University of Sydney that was published this month about the egg, and it's caught a lot of bad press in the last 5 to 10 years. What they did, though, was they started out a study looking at 128 people who were either pre-diabetic or diabetic.
Okay.
And they put them on a weight maintenance program for 3 months. And after that 3 months, then they looked at all the cardiovascular risk, numbers like what your blood sugar looked like, your A1C, your cholesterol, blood pressure. And they noticed that after a 3-month trial of maintaining weight, now they put people on an exercise program and then just a weight maintenance program, that there was no change in the cardiovascular risk parameters, right? So they extended the study and they stretched it out over a year, and they said, okay, we're going to do a weight loss arm to this whole thing too. So they they randomized folks to either 12 or more eggs a week. Okay, so that's a couple eggs a day,
okay,
versus less than 2 eggs a week. Okay, and so there was no demonstrable change over a 12-month period in the weight loss. They had same weight loss and then no change in those risk factor markers, like no change in blood pressure between the two groups, no change in their blood sugars, their A1C, which is kind of the way we measure how well controlled diabetes is over a period of time.
Okay.
No change in like the C-reactive protein, which is one of the inflammatory markers we look at if you have high cholesterol. And so it's kind of changing our perspective on this. Doesn't mean you just need to go out and start, scrambling up a bunch of eggs.
Eating 12 a day?
Well, it's not so much that. It's that, okay, keeping everything in moderation. They did this now combined with a healthy diet approach. So they swapped out butter for mono or monounsaturated fats like olive oil, avocado oil instead of butter. So they took a healthy approach to the whole thing. But if they isolated the egg as being a bad actor, there was really no difference in a high consumption arm and a low consumption arm. So it gives us new perspective. Like we always say in these settings, more data is to come, but it sheds at least a favorable light on what was otherwise taking a bad rap.
Yeah, and eggs, of course, are something that are used for breakfast. It's so many different recipes.
Absolutely.
I mean, they are an essential part of a diet, and a lot of trainers will tell you a healthy diet, too. Make sure you eat your eggs.
That's right. Yeah. So very reassuring data and something to revisit now as far as, like say at the grocery store and in your refrigerator.
Now we got to work on butter.
That's right.
If there's a study out that says butter is healthy,
you're
the happiest man in this room right now.
Bacon.
All right, thank you. So, yes, exactly. All right, that is Dr. Scott Davis, of course, from Baptist Health. You can contact the Baptist Health Helpline at the number on your screen.